Tell me about yourself.
I am a compassionate and dedicated individual with a strong desire to support vulnerable people in society. I hold a diploma in health and social care, and I have over 2 years of experience working in residential care settings, supporting elderly residents and adults with learning disabilities. I am known for my patience, active listening skills, and ability to build trusting relationships with service users. Outside work, I often volunteer in community outreach programs, which enhances my understanding of diverse needs. I am now looking forward to joining your team to continue providing person-centered care.
Why do you want to work as a social care worker?
I want to work as a social care worker because I genuinely care about helping others live with dignity and independence. I believe everyone deserves respect and support regardless of their challenges. Working in this field gives me the opportunity to make a real difference in people's daily lives, whether it is helping them with personal care, emotional support, or social activities. I find it rewarding to be part of their journey towards better well-being.
What do you understand by person-centered care?
Person-centered care means putting the service user at the heart of everything we do. It involves understanding their unique needs, preferences, and values, and making sure their voice is heard in all decisions about their care. For example, respecting their choices in daily routines, meals, and activities, and promoting their independence as much as possible while ensuring their safety and well-being.
How do you handle challenging behavior?
When facing challenging behavior, I remain calm and patient. First, I try to understand the cause behind their behavior, as it may be due to pain, discomfort, confusion, or unmet needs. I use de-escalation techniques like speaking softly, giving them space, and actively listening to their concerns. If necessary, I follow the care plan and seek support from senior staff while ensuring everyone's safety.
How would you safeguard a vulnerable person?
Safeguarding involves protecting vulnerable people from harm, abuse, or neglect. If I notice any signs of abuse, such as unexplained injuries, sudden behavioral changes, or disclosures, I would remain calm, listen without judgment, and reassure them. I would record the information accurately and immediately report it to my manager or the designated safeguarding officer, following the organization's policies and procedures to ensure their safety.
What are your strengths as a social care worker?
My main strengths include my empathy, patience, and effective communication skills. I can easily build rapport with service users, making them feel comfortable and respected. I am also organized and attentive to detail, which helps in maintaining accurate care records and following care plans correctly. Additionally, I am a good team player and always ready to support my colleagues when needed.
Where do you see yourself in 5 years?
In 5 years, I see myself having gained extensive experience in social care and possibly progressing to a senior care worker or team leader role. I also plan to pursue additional training in mental health or counseling to support service users more effectively. My aim is to continue making a positive impact in the social care sector.
How do you prioritize your workload during a busy shift?
I prioritize my workload by first identifying urgent needs, such as assisting service users with personal care, medication, or any immediate risks to their safety. I then organize other tasks like documentation, housekeeping duties, and activities based on their importance and care plans. Good time management and clear communication with my team help ensure that all tasks are completed efficiently without compromising quality of care.
Can you give an example of when you worked effectively as part of a team?
During my previous role in a residential care home, one morning we were short-staffed and it was a busy day with multiple residents needing assistance at the same time. I communicated clearly with my colleagues, delegated tasks where appropriate, and supported each other to ensure all residents received timely personal care and breakfast. By working as a team and staying calm, we managed the shift smoothly without compromising on care quality.
How would you support a service user who is feeling lonely or depressed?
If a service user feels lonely or depressed, I would first listen to them empathetically and validate their feelings. I would encourage them to participate in activities they enjoy, facilitate social interactions with other residents if they wish, and spend quality time talking with them. Additionally, I would inform my senior or supervisor so that appropriate mental health support or counseling referrals can be arranged if needed.
How do you ensure dignity and respect while providing personal care?
To ensure dignity and respect, I explain what I am going to do before starting personal care, seek their consent, and maintain privacy by closing doors or curtains. I cover them appropriately to keep them warm and comfortable and involve them as much as possible in their care. I'd always treat them with kindness and avoid rushing, as everyone deserves to feel respected during personal care tasks.
What skills are important for a social care worker?
Important skills for a social care worker include excellent communication, empathy, patience, reliability, and problem-solving skills. It is also important to have good observational skills to notice changes in a service user's condition and the ability to work well under pressure while maintaining professionalism and compassion at all times.
What motivates you in this role?
I am motivated by knowing that my work makes a positive difference in someone's life each day. Seeing service users happy, comfortable, and achieving small goals because of the support I provide gives me a strong sense of purpose and fulfillment. It drives me to continue learning and giving my best in this role.
How would you manage stress in this job?
To manage stress, I focus on staying organized and prioritizing tasks effectively. During breaks, I take time to relax and clear my mind. After work, I engage in activities I enjoy, like listening to music or spending time with family, which helps me unwind. I also believe in seeking support from colleagues or supervisors if work pressures become overwhelming.
Why should we hire you as a social care worker?
You should hire me because I am deeply passionate about caring for others and have the skills and attitude required for this role. I am empathetic, reliable, and a fast learner. I understand the importance of safeguarding, confidentiality, and person-centered care. I also work well under pressure and as part of a team. I am committed to providing high-quality care and supporting service users to live with dignity and independence.
What do you think is the biggest challenge in social care work?
The biggest challenge in social care work is balancing multiple service users' needs while managing emotional demands, especially when supporting those with complex conditions. However, with good time management, teamwork, and self-care strategies, these challenges can be managed effectively to provide high-quality care.
How do you update yourself with new care practices or knowledge?
I keep myself updated by attending training sessions offered by my employer, reading guidelines from reputable health and care organizations, and discussing best practices with colleagues. I'd also reflect on my experiences and seek feedback from supervisors to continuously improve my skills and knowledge in care.
Do you have any questions for us?
Yes, thank you. Could you tell me more about the team I would be working with and the induction training program for new staff? Also, how does the organization support continuous professional development for its social care workers?